April 2, 1979. Sverdlovsk, USSR, 8:47 a.m. Dr. Viktor Romanenko stood at the window of hospital number 40, watching ambulances arrive in intervals that reminded him of wartime. Each brought the same mysterious presentation. Previously healthy workers gasping for air, their chests filled with fluid, fever spiking toward 104 degrees. In 12 hours, they would be dead. The patients shared peculiar commonalities. Most worked at the ceramics factory in the Southern District. All had been outdoors on April 2nd between noon and 3 p.m. And each presented with symptoms Romanenko had only read about in classified military medical textbooks, the kind that discussed weaponized pathogens rather than natural disease. By evening, he had 17 corpses and no official explanation he could believe. The local health director had already visited twice, instructing him in quiet, firm tones to record the diagnosis as intestinal anthrax from contaminated meat. But Romanenko had performed autopsies. The lungs were hemorrhage black, filled with bloody fluid. The lymph nodes had swollen to grotesque sizes. This was inhalational anthrax, the kind that only occurred when bacterial spores were breathed directly into the lungs. There was no contaminated meat. There had been something in the air. 3 miles northwest, at a military facility marked on no civilian maps, a maintenance supervisor named Nikolai Chernyshev was being interrogated by KGB officers. They wanted to know exactly when he had removed the clogged filter from ventilation shaft number 7, and, more importantly, whether he had told anyone that he'd forgotten to replace it before his shift ended on April 1st. By April 5th, 66 people would be dead. The Soviet Union would spend 2 decades constructing an elaborate lie, and the United States would watch, unable to prove what its intelligence agencies already knew. That Compound 19, the secret anthrax production facility the Soviets swore didn't exist, had just poisoned an entire city with their own biological weapons. In the first chaotic hours after victims began arriving at Sverdlovsk's hospitals, Soviet authorities faced a crisis that struck at the heart of their Cold War deception. The 1972 Biological Weapons Convention, which the USSR had signed with great fanfare, explicitly banned the development, production, and stockpiling of biological weapons. Yet here, in an industrial city of 1.2 million people, citizens were dying from what appeared to be weaponized anthrax released from a military facility that officially didn't exist. The initial Soviet response revealed both the sophistication of their disinformation apparatus and the genuine panic of local officials caught between public health obligations and state security demands. Within 6 hours of the first deaths, KGB officers were already at hospital bedsides instructing doctors on proper diagnoses. Gastrointestinal anthrax from contaminated meat, they insisted. A natural outbreak. Tragic but not unusual in springtime when people buy black market meat. Dr. Lev Grinberg, the chief pathologist who would later defect and tell the true story, recalled the moment he understood the scope of the deception. A KGB colonel stood in my autopsy room and watched me examine lungs that were solid black with hemorrhage. He asked me, very politely, if these findings were consistent with intestinal anthrax. When I said no, that these lungs showed clear evidence of inhalational exposure, he said, "Perhaps you should examine them again, more carefully this time." The meat contamination story required immediate supporting evidence. Within 24 hours, KGB agents had confiscated meat from private vendors at the Kalinin market, south of the outbreak zone. State television broadcast footage of unsanitary conditions. Vendors were arrested for selling contaminated products. The Public Health Department issued statements about the dangers of black market meat purchased outside official state stores. American intelligence officials, monitoring the situation through satellite imagery and human sources, perceived something entirely different. The CIA's Office of Scientific Intelligence had been tracking Compound 19. officially known as Military Facility 19, but referred to by analysts as Sverdlovsk 19 since the early 1970s. By April 5th, when unusual ambulance patterns were detected by satellite, analysts were already suspicious. We had high confidence that Sverdlovsk 19 was a biological weapons production facility, recalled Dr. Thomas Gaisbert, a former USAMRIID biodefense researcher who later analyzed the incident. When we started seeing reports of anthrax cases, the immediate question wasn't whether there had been a release. It was how do we prove it without compromising sources. The Reagan administration, which would take office 18 months later, would inherit this intelligence puzzle. But in April 1979, the Carter administration faced a diplomatic calculation. Accuse the Soviets of violating the Biological Weapons Convention based on circumstantial evidence, or wait for proof that might never come. State Department cables from the period show the frustration. One analyst wrote, "We know what happened. They know we know. They know we can't prove it. This is Cold War chess at its most cynical." Soviet officials at the highest levels understood the stakes perfectly. General Yevgeny Smirnov, chief of the main military medical directorate, told subordinates, "This incident never happened. And if anyone suggests it did happen, it was contaminated meat. We have maintained plausible deniability on biological weapons development for years. We will not lose it over one maintenance worker's mistake." The initial perceptions, then, divided along predictable Cold War lines. Soviet officials saw a containable disaster requiring aggressive information management. American intelligence saw confirmation of long-suspected treaty violations, but lacked the evidence to act. And the citizens of Sverdlovsk, watching neighbors die and soldiers scrubbing the streets with chlorine, saw their government's assurances and trusted them. Because what else could they do? The Soviet biological weapons program that would accidentally devastate Sverdlovsk had its origins in the early days of the Cold War, born from a peculiarly Soviet combination of paranoia, scientific ambition, and strategic calculation. While the United States abandoned offensive biological weapons in 1969 under President Nixon, the Soviet Union made a different choice: expand dramatically while signing treaties that forbade such work. The architect of this vast deception was Yuri Ovchinnikov, a biochemist and Communist Party loyalist who convinced Leonid Brezhnev in 1973 that biological weapons represented the ultimate strategic equalizer. Nuclear weapons announced themselves, Ovchinnikov argued in a classified memo to the Politburo. Biological weapons could devastate an enemy and leave no fingerprints. The Americans will inspect our nuclear facilities. They will never see our real strength. This philosophy gave birth to Biopreparat, a sprawling network of seemingly civilian pharmaceutical and research facilities that masked the world's largest biological weapons program. By 1979, the program employed over 30,000 scientists and technicians across 40 facilities. Compound 19 in Sverdlovsk was just one node in this secret network. Sverdlovsk 19 had been producing anthrax spores since 1953, but its mission expanded significantly after the Biological Weapons Convention. The facility's official designation was the Sverdlovsk Institute of Microbiology and Virology, suggesting basic research. In reality, Building 19-05 contained large-scale fermenters capable of producing hundreds of kilograms of weaponized anthrax spores, refined to specific particle sizes optimized for human lung penetration. Colonel Nikolai Yurakov, who commanded Compound 19 in 1979, later admitted in partial testimony, "We were under tremendous pressure to increase production. The Americans were ahead in missile technology. We needed something to maintain strategic parity. Biological weapons were that equalizer." The facility's location in Sverdlovsk was strategic. The city was closed to foreigners, designated as such due to its concentration of military industries. This provided operational security, while the surrounding Ural Mountains offered natural isolation. But it also meant that hundreds of thousands of ordinary Soviet citizens lived downwind of one of the world's most dangerous laboratories. The safety protocols at Compound 19 were, by Western standards, shockingly inadequate. The facility relied on a series of filters to prevent pathogen release, filters that required regular maintenance and replacement. These filters were the last barrier between weaponized anthrax production and the surrounding city. Nikolai Chernyshev, the maintenance supervisor whose mistake would kill dozens, had worked at Compound 19 for 11 years. He was not a scientist or a soldier, but a civilian technician responsible for maintaining ventilation systems. On March 30, 1979, he noticed that filter 7B in the exhaust system for building 1905 had become clogged. Following standard procedure, he removed it for cleaning. His shift ended before the replacement filter could be installed. Protocol required him to note this in the maintenance log and inform the incoming shift supervisor. According to later investigation, Chernyshev forgot, or perhaps assumed the night shift would notice the missing filter on their rounds. They didn't. For nearly 24 hours, weaponized anthrax spores produced in Building 1905's fermenters were exhausted directly into the atmosphere through an unfiltered ventilation shaft. The production run happening during this period was, horrifically, one of the largest in the facility's history. Military deadlines demanded increased output. The fermenters were running at capacity, producing an anthrax strain designated Strain 836, modified for increased virulence and environmental stability. On April 2, 1979, at approximately 11 a.m., day shift supervisor Major Alexei Demidov noticed the missing filter during a routine inspection. He immediately ordered production halted and the filter replaced. But by then, winds had been carrying microscopic anthrax spores across southern Sverdlovsk for nearly a full day. Meteorological records would later prove crucial to understanding the outbreak. On April 2nd, winds blew from the northwest, directly from Compound 19 toward the southern residential and factory districts. The wind pattern was steady, around 8-12 kilometers per hour, ideal for dispersing particles across a wide area. By noon on April 2nd, an invisible cloud of death had settled over neighborhoods, factories, and markets. People going about their ordinary lives, buying bread, walking to work, visiting friends, were breathing in bacterial spores that would kill most of them within days. The first victim to die was a ceramics factory worker named Ivan Mironov. He arrived at Hospital Number 40 at 7:30 p.m. on April 3rd, complaining of difficulty breathing and chest pain. Within hours, his condition deteriorated catastrophically. By morning, he was dead. Doctors had never seen anything like it. The speed of decline, the massive hemorrhaging in the lungs, the complete ineffectiveness of antibiotics started too late. The outbreak had begun, and the cover-up was about to become one of the Cold War's most elaborate deceptions. On April 4th, 1979, the deaths begin. The true horror of what had happened at Compound 19 became apparent over 48 hours of escalating medical crisis. Hospital Number 40, Sverdlovsk's main infectious disease center, transformed into a battlefield against an enemy most doctors had never encountered outside textbooks. Dr. Faina Abramova, head of pathology at the hospital, performed the first autopsy on Ivan Mironov at 6 a.m. on April 4th. What she found terrified her. The lungs were not lungs anymore, she later testified after the Soviet Union's collapse. They were masses of hemorrhage, black and solid. The hilar lymph nodes, the ones near the lungs, had swollen to the size of hen's eggs. The spleen was massive. This was not natural disease. This was something created. By midday, April 4th, 12 more patients had died. All presented identical symptoms: high fever, severe respiratory distress, cyanosis, skin turning blue from lack of oxygen, and death within 24 to 48 hours of symptom onset. The case fatality rate was approaching 90%, far higher than natural anthrax. Dr. Viktor Romanenko, who had been on duty when the first victims arrived, began mapping cases on a city chart. The pattern was obvious and damning. All victims lived or worked in a narrow corridor extending southeast from the area around Compound 19. The wind direction on April 2nd. It was an epidemiological signature of an airborne release, he later explained. Not food contamination spreading randomly through markets, but an aerosol pattern following wind direction. The KGB descends. By April 5th, with the death toll reaching 40, the magnitude of the crisis reached Moscow. KGB Chairman Yuri Andropov personally ordered a full response. Within hours, teams arrived in Sverdlovsk with clear instructions. Contain the information, support the contaminated meat narrative, and eliminate any evidence suggesting an airborne biological weapons release. Major General Viktor Koltunov of the KGB's Special Department took command of the operation. His first act was to classify all medical records related to the outbreak. Doctors were required to submit patient files to KGB officers who would review them, and in many cases, never return them. Dr. Lev Grinberg, the pathologist who would later become the key source for understanding what really happened, watched KGB officers confiscate tissue samples he had carefully preserved. They took everything: lung tissue, blood samples, even my autopsy notes, he recalled. When I protested that we needed these samples to understand the disease and save lives, a colonel told me, "The lives that matter now are not your patients. They're already dead. Think about your own life, doctor." The meat contamination story required elaborate staging. KGB agents orchestrated police raids on the Kalinin market, confiscating meat from vendors and replacing it with deliberately contaminated samples. Television crews filmed the evidence. State-run newspapers published detailed stories about unsanitary conditions and the dangers of black market meat. But the KGB faced a significant problem. The victims weren't showing symptoms of gastrointestinal anthrax, which results from eating contaminated meat. That form produces severe abdominal pain, bloody vomit, and bowel distress. These victims had respiratory symptoms: hemorrhaged lungs, not damaged intestines. The solution was medical fraud on a stunning scale. Doctors were instructed to revise death certificates. Pneumonia complicated by anthrax infection became the standard diagnosis, vague enough to support the meat story while technically mentioning anthrax. Actual autopsy findings were rewritten or destroyed. The American investigation. While the KGB orchestrated its cover-up, American intelligence agencies scrambled to understand what had happened. The CIA's Office of Scientific and Weapons Research obtained initial reports through human intelligence sources, most likely medical personnel or party officials troubled by what they were witnessing. A classified CIA memorandum dated April 12, 1979, assessed the situation. High confidence that an accidental release of biological agents occurred at Sverdlovsk military facility. Pattern of casualties consistent with aerosol dispersal of anthrax. Soviet responses, quarantine measures, decontamination operations, and information control suggest this assessment is correct. Satellite imagery provided additional evidence. KH-11 reconnaissance satellites detected unusual activity at Compound 19 immediately after the outbreak. Decontamination teams in protective suits, extensive washing of building exteriors with chemicals, and temporary shutdown of production facilities. Even more damning was the Soviet response in affected neighborhoods. Military units deployed to wash streets, sidewalks, and building facades with calcium hypochlorite solution, a decontamination measure that made no sense for food contamination, but perfect sense for airborne pathogen dispersal. We watched them scrub the entire southern district of the city, recalled Frank Marsh, a CIA satellite imagery analyst. That's not how you respond to contaminated meat at a market. That's how you decontaminate after a bioweapons release. April 10-12. The vaccination campaign, the Soviet response included one measure that confirmed Western suspicions: a massive emergency vaccination campaign. Starting April 10th, military medical teams vaccinated over 200,000 Sverdlovsk residents against anthrax, a vaccine not routinely administered to civilian populations. This created a logical problem for the meat contamination narrative. If the outbreak was from contaminated meat at one market, why vaccinate the entire city? Why focus vaccination efforts specifically in the southern districts downwind from Compound 19? Dr. Pyotr Burgasov, Soviet Deputy Minister of Health, tried to explain in a press conference. We are taking preventive measures to protect the population from any further contaminated meat that might enter the food supply. But Western epidemiologists noted the absurdity. You don't vaccinate against foodborne illness that's already occurred. The death of Dr. Mikhail Markov. One of the outbreak's most poignant casualties was Dr. Mikhail Markov, a veterinarian who worked at the ceramics factory's cafeteria, inspecting meat deliveries. On April 8th, he was hospitalized with anthrax symptoms. Before dying on April 9th, he told his wife, "I inspected all the meat that week. There was nothing wrong with it. This isn't from food, Sonia. This is something else." His death created particular problems for the KGB narrative. As a veterinarian whose job was literally inspecting meat, his diagnosis of anthrax from contaminated meat seemed almost darkly ironic. His wife's questions to authorities went unanswered. His medical records were confiscated. The final count, by April 20th, the outbreak had run its course. Official Soviet statistics would eventually acknowledge 96 cases, with 64 deaths. But these numbers were certainly undercounts. Dr. Matthew Meselson, the Harvard biologist who would later investigate the incident, estimated the true death toll at closer to 100 or 105, based on cemetery records and witness testimony. What made the death toll even more tragic was that it was entirely preventable. Anthrax is highly treatable with early antibiotic intervention. But the Soviets' insistence on the contaminated meat story created fatal delays. Doctors treating early cases for gastrointestinal symptoms gave antibiotics too late or in insufficient doses to address inhalational anthrax, which requires immediate, aggressive treatment. The victims were workers, families, ordinary Soviet citizens, people who had no idea they lived near a biological weapons facility, who trusted their government when told to worry about bad meat, who died because of a maintenance worker's forgotten task and a state's determination to hide the truth. The Soviet disinformation campaign. In the months following the outbreak, the Soviet Union refined its deception into a comprehensive disinformation operation that would last 2 decades. The effort involved multiple government agencies coordinating their lies with remarkable discipline. The Ministry of Health published a detailed epidemiological study in 1980, attributing the outbreak to contaminated bone meal sold at illegal markets. The study included fabricated data about gastrointestinal symptoms and supposedly traced meat sources. Dr. Pyotr Burgasov, who led this effort, later admitted, "We knew we were lying, but it was necessary for state security." The KGB took more direct action against witnesses. Doctors who had treated victims were transferred to distant posts. Hospital records were sealed in classified archives. The few independent journalists who asked questions found their careers ended. One, a reporter for the local Sverdlovsk newspaper, was arrested on fabricated embezzlement charges when he persisted in questioning the meat contamination story. Perhaps most cynically, The Soviets used their contaminated meat narrative to reinforce communist ideology. State media turned the incident into a morality tale about the dangers of capitalist-style black market activity. This tragedy happened because Soviet citizens ignored state meat distribution systems and purchased from illegal vendors, proclaimed Pravda in a May 1979 editorial. When we deviate from socialist principles, we suffer. The deception extended to the international scientific community. Soviet researchers published papers in medical journals describing an outbreak of gastrointestinal anthrax. These papers were technically fraudulent. They cited symptoms and pathological findings that didn't match the actual medical evidence. The American response and Cold War implications, the Reagan administration, taking office in January 1981, elevated the Sverdlovsk incident to a major arms control issue. Reagan himself raised it in a 1986 meeting with Mikhail Gorbachev, asking pointedly, "If you have ended your biological weapons program as you claim, what happened at Sverdlovsk?" Gorbachev insisted the contaminated meat story was true. According to memoirs of George Shultz, Reagan's Secretary of State, Gorbachev seemed genuinely to believe it, suggesting that even the Soviet General Secretary had been fed the KGB's lies. The incident significantly complicated arms control negotiations throughout the 1980s. American negotiators viewed Soviet denials about Sverdlovsk as proof that the USSR couldn't be trusted on any treaty verification. How could you negotiate biological weapons limitations with a country that wouldn't admit to an obvious accident at a biological weapons facility? This suspicion extended to other arms control initiatives. The INF treaty negotiations and START talks both were slowed by American concerns about Soviet duplicity. Sverdlovsk wasn't about one incident, explained Richard Pearl, Reagan's Assistant Secretary of Defense. It was about whether the Soviet system was fundamentally capable of honest dealing on security matters. Intelligence evolution. The CIA refined its biological weapons intelligence capabilities in response to Sverdlovsk. The agency established specialized analytical units focused on Soviet biowarfare programs, invested in better satellite surveillance of suspected facilities, and recruited sources within the Soviet scientific establishment. One major intelligence success came in 1989, when Vladimir Pasechnik, a senior scientist in the Biopreparat program, defected to Britain. His debriefing confirmed Western suspicions. The Soviet biological weapons program was massive, sophisticated, and in flagrant violation of the 1972 Convention. Sverdlovsk had been exactly what American intelligence thought, an accidental release from a weapons production facility. Pasechnik's information was so alarming that it prompted a rare Anglo-American joint intelligence assessment. The report concluded that the Soviet Union had weaponized smallpox, plague, and anthrax in quantities sufficient to kill millions. Sverdlovsk hadn't been an isolated facility, but part of a network spanning the USSR. The scientific investigation one man became obsessed with definitively proving what happened at Sverdlovsk. Dr. Matthew Meselson of Harvard University, a biologist who had helped convince Nixon to abandon biological weapons, Meselson viewed the Sverdlovsk incident as crucial to understanding Soviet compliance with arms control treaties. Throughout the 1980s, Meselson made repeated requests to Soviet authorities for access to medical records and the opportunity to interview survivors. He was refused every time, but he continued collecting evidence, tracking down émigrés who had lived in Sverdlovsk, obtaining smuggled documents, analyzing weather patterns. His breakthrough came in 1988 when he obtained a list of victims' addresses from a source he never publicly identified. Plotting these addresses on a map of Sverdlovsk, Meselson found exactly what he expected: a narrow plume extending southeast from Compound 19, following the wind direction on April 2nd, 1979. It was epidemiological proof, Meselson later explained. Contaminated meat produces random geographic distribution. An airborne release produces a plume pattern aligned with wind direction. The data fit the aerosol release hypothesis perfectly and contradicted the contaminated meat story completely. Gorbachev's reforms and persistent denial. Even as glasnost opened Soviet society, the Sverdlovsk lie persisted. Gorbachev's reforms allowed discussion of many previously taboo subjects: Stalin's crimes, economic failures, even questioning of communist ideology. But the biological weapons program remained off-limits. In 1988, after Reagan pressured him again about Sverdlovsk, Gorbachev ordered an internal investigation. KGB reports confirmed what Western intelligence had concluded. Accidental release from Compound 19, inhalational anthrax, massive cover-up. But Gorbachev chose to maintain the public fiction, likely because admitting the truth would confirm that the Soviet Union had systematically violated a major arms control treaty for years. Some Soviet scientists began quietly distancing themselves from the official story. In private conversations at international conferences, Soviet researchers would hint at the truth. "We had an unfortunate incident," one told an American colleague. "But you must understand, if we admitted what really happened, it would be catastrophic for our negotiating position." The Cold War logic was clear. Maintaining the lie was worth more than the truth. The collapse and the truth emerges. The fall of the Soviet Union in 1991 finally created conditions for the truth to emerge. In June 1992, Russian President Boris Yeltsin made a stunning admission. In a speech to the Russian Supreme Soviet, he stated, "The KGB admitted that our military developments were the cause of the Sverdlovsk outbreak." It was an incomplete admission. Yeltsin didn't elaborate on what military developments meant or acknowledge the biological weapons program's scope. But it was the first time any Russian leader had contradicted the contaminated meat story. More complete truth came from Dr. Meselson's investigation. In 1992, Yeltsin personally authorized Meselson's team to visit Sverdlovsk, now renamed Yekaterinburg after the Soviet collapse, and conduct a full epidemiological investigation. What Meselson's team found was devastating confirmation. Dr. Lev Grinberg, the pathologist who had been forced to falsify records in 1979, still had tissue samples he had secretly preserved, stored in his personal freezer for 13 years because he knew they were important. Analysis confirmed inhalational anthrax. Meselson interviewed 47 survivors and family members of victims. Every interview contradicted the contaminated meat narrative. "They told us no one had eaten contaminated meat," Meselson recounted. "They told us about soldiers washing streets with chemicals. They told us about the vaccination campaign. They told us about relatives dying from respiratory symptoms, not gastrointestinal problems." Weather data obtained from Soviet archives showed winds on April 2, 1979, blowing directly from Compound 19 toward all documented victim locations. Combining meteorological data with victim addresses, Meselson's team reconstructed the release. Approximately 2 to 4 kilograms of weaponized anthrax spores released over several hours, creating a plume extending roughly 4 kilometers downwind. The findings were published in Science in 1994, providing definitive proof of what American intelligence had concluded 15 years earlier. The paper became one of the most cited in biological weapons research, a forensic masterwork of epidemiological detective work. The human cost calculated. As records became accessible, the full human tragedy came into focus. The 64 official deaths were undercounted. Cemetery records and family testimonies suggested 105 deaths, though the exact number remains uncertain because some victims were cremated and records were destroyed. But beyond the immediate deaths, Hundreds suffered permanent health damage. Survivors dealt with chronic respiratory problems, neurological damage from severe infections, and the psychological trauma of knowing their government had poisoned them and then lied about it for 20 years. Anna Komina, who lost her husband in the outbreak, told Meselson's team, "For 13 years, I believed the government. I thought my husband died because he bought bad meat, that it was partly his fault for shopping at an illegal market. Then I learned the truth, that he died because of a weapons facility we didn't even know existed, an accident they hid. The anger is worse than the grief." The families never received meaningful compensation or official apology. Yeltsin's admission was vague and brief. No Soviet officials were ever prosecuted for the cover-up or the illegal weapons program. International implications, the confirmed violation of the Biological Weapons Convention, had far-reaching effects on arms control. It vindicated decades of American suspicions and undermined trust in treaty compliance. If the Soviets had so brazenly violated the biological weapons ban, while simultaneously accusing the United States of doing the same, what did that say about other treaties? The incident shaped U.S. policy toward Russia throughout the 1990s and 2000s. American officials pushed for much more intrusive verification measures in arms control agreements. The trust but verify approach became verify, verify, verify. It also revealed the limitations of Cold War arms control. The Biological Weapons Convention had no verification provisions. Signing countries essentially promised to comply with no inspections. Sverdlovsk proved this approach was dangerously naive. Scientific and medical legacy. For biological weapons researchers, Sverdlovsk became the most thoroughly documented case study of an anthrax aerosol release, knowledge that was both scientifically valuable and deeply troubling. The data revealed how effective weaponized anthrax could be and how devastating an intentional release might prove. Dr. Ken Alibek, another biopreparat defector, later revealed that Soviet scientists studied the Sverdlovsk accident intensely to improve their weapons. "We learned optimal particle sizes, dispersal patterns, environmental stability," he admitted. A terrible accident became research data for making weapons even more effective. This created an ethical dilemma still debated today. Should the Sverdlovsk data be published openly to help public health officials prepare for bioterrorism, or classified to prevent terrorists from learning how to optimize biological attacks? The facility's Fate Compound 19 continued operating until 1992, though reportedly not for weapons production after 1990. The facility was partially dismantled under the Nunn-Lugar Cooperative Threat Reduction Program, which helped former Soviet states secure or destroy weapons materials. Today, the site operates as a pharmaceutical research facility. The buildings where weaponized anthrax was produced still stand, though heavily modified. Local residents remain wary. Trust, once broken, is hard to rebuild. The Sverdlovsk anthrax outbreak stands as one of the Cold War's most revealing incidents. Not because it was the most dangerous moment in superpower confrontation, but because it exposed the fundamental dishonesty underlying Cold War arms control. For 20 years, the Soviet Union maintained an elaborate lie in the face of overwhelming evidence. The deception required corrupting the medical profession, intimidating witnesses, falsifying scientific records, and cynically manipulating ideology to blame capitalism for communist failures. It demonstrated that the Soviet system, for all Gorbachev's reforms, remained incapable of honest accounting about its own actions. The incident vindicated Western skepticism about Soviet compliance, while also revealing the limits of intelligence. The CIA correctly assessed what happened almost immediately, but couldn't prove it definitively until the Soviet collapse. The knowing without being able to prove became a recurring Cold War frustration. one that shaped American demands for intrusive verification in future arms control agreements. Perhaps most troublingly, Sverdlovsk revealed that biological weapons development had continued and even accelerated after both superpowers publicly renounced such programs. The Soviet Union had signed the 1972 Biological Weapons Convention while simultaneously building the world's largest biological weapons program. This betrayal poisoned arms control efforts for decades and contributed to American unilateralism in security policy. Dr. Matthew Meselson, reflecting on his investigation, offered a sobering assessment. Sverdlovsk taught us that arms control agreements without robust verification are simply wishes. Nations will violate treaties when they believe it serves their interests, and they won't be caught. The human tragedy often gets lost in the geopolitical analysis. Over 100 Soviet citizens died from weaponized anthrax produced by their own military, then were denied truth about their deaths for 2 decades. Their families were lied to, their medical records falsified, their deaths blamed on their own supposed violations of socialist purchasing rules. They were victims twice, once of the accident, once of the cover-up. In today's context, Sverdlovsk serves as a cautionary tale about biological weapons proliferation and the challenge of verifying compliance with arms control agreements. The incident provided the most complete data on human exposure to weaponized anthrax, data that both helps prepare for bioterrorism and potentially aids those seeking to develop biological weapons. Back in Hospital Number 40 in 1979, Dr. Viktor Romanenko knew the truth but couldn't speak it. He watched patients die, mapped the outbreak pattern, understood the implications, and was forced to write pneumonia complicated by intestinal anthrax on death certificates. He carried that knowledge for 13 years, until finally, after the Soviet collapse, he could tell his story. The hardest part, he said in 1993, wasn't lying to the authorities. It was lying to the families. They came to me asking how their husband or son died, and I had to tell them a story I knew was false. I still see their faces. The Sverdlovsk anthrax outbreak killed over 100 people. The cover-up killed truth. And in the Cold War, as Romanenko learned, sometimes the second death was more lasting than the first.